Hi, Dr. Sturs. This is Ryan Hill with KIN302, and we're going over our critical assignment of sleep deprivation. So, sleep deprivation, which is defined by the International Classification of Sleep Disorders, is when an individual experiences a diminished sleep pattern lasting at least 3 months, persisting through most days of the week, accompanied by complaints or feelings of drowsiness during the day. So this can include multiple factors as far as like sleep quality goes. So one is, sleep quality and sleep duration. So how long are you sleeping? Are you getting your 7, 8, 9 hours per day, which is kind of the recommended range of sleep? Are you getting, is your sleep interrupted? So are you getting that, that deep, that REM sleep? Or are you getting like really shallow sleep, waking up multiple times throughout the night? Or how often are you sleeping? So that could include, are you sleeping, 3-4 hours during the night and then a couple hours during the day, and maybe you're taking multiple naps. All of those factors can contribute to sleep deprivation. Sleep deprivation as a sleeping condition is a sleeping condition that has reached epidemic levels of prevalence, with over 35% of the population identifying as sleep deprived. That is a extremely significant amount of the population, about 100 million people in the United States, roughly. If any other condition, just about reached that level of prevalence, it would be a national crisis. But sleep deprivation, however prevalent it is an issue that's extremely overlooked and regarded by most as minor and unimportant, even though it's been proven to seriously affect health-related factors and quality of life. So this presentation will be reviewing the effects of sleep deprivation on the individual, on collective public health, and explain why we need just more sleep. In the past few decades, there's been a significant increase in screen time and sedentary behavior, and research shows that both of these factors have a very significant negative correlation with sleep quality, sleep duration, and sleep prevalence. Every single one of those factors that contributes to sleep deprivation are impacted by these kind of behaviors. And, as phones are getting more common, cell phones are getting more common, video games, people are staying up late into the night watching or playing video games, watching TV, watching movies, all that kind of stuff. Sleep quality is decreasing significantly because of that. Research shows that between 15 and 30% of American and European workers engaging in shift work as a part of their profession are sleep deprived. This kind of work often causes them to work late into the night, which disrupts their circadian rhythm, which is just your 24-hour, sleep-wake cycle, and can cause shortened sleep duration and reduced sleep quality. And doctors and practitioners also fail to stress the importance of sleep in patients, despite its connection to so many adverse health outcomes. Which again we'll discuss a little bit later. In a study on the neglect of practitioners and doctors to address sleep deprivation as a health issue, it was discovered that out of the 14 practitioners surveyed, only 6 presented any questions about sleep health, which 4 of which were about 4 of those 6 practitioners asked about obstructive sleep apnea, nightmares, snoring, and insomnia. And the study mentioned that obstructive sleep apnea, they asked about that as a respiratory symptom, not as a sleep symptom. Nightmares, they asked because as like a psychological symptom, not as a sleep symptom, or not symptom. Sleep sleep health thing. Symptom might be the right word. I'm blanking here. Snoring, which again, respiratory, and insomnia, which is the only one that is a actual sleep condition, respectively. So, they didn't ask about them in regards to sleep quality or sleep health. They asked them in regards to, respiratory and psychological health. And 2 of which generally address sleep concerns. The way that they presented it was, in their like when you go and you fill out, like when you go to a doctor's office, you fill out like your, what are your symptoms? What are you coming in for? That kind of thing. They just had sleep concerns as a checkbox. and they didn't necessarily address it during the checkup, or during the actual like consult, but they just had them as, you know, a little checkbox. And none of them inquired seriously about the topic of sleep. You know, they didn't ask deeper questions about sleep. They really just addressed those four things, and kind of just left it at that. Didn't dig any deeper. Didn't refer them to a sleep specialist. Didn't nothing like that. Just kind of, oh, okay, these are your symptoms, whatever. Which is a big issue because, you know, as we're about to go over, there are a lot of health issues that can, you know, be caused and be influenced by sleep deprivation. So risk factors for sleep deprivation include longer working hours, which we kind of discussed a little bit earlier with shift work, higher perceived workloads, lower levels of education, singleness, smoking, sobriety, alcohol abuse, obesity, depression, anxiety, age, gender, cardiovascular disease, physical activity levels, both low and overtraining, interpersonal conflict, and socioeconomic factors. So really just think about all the things that could keep you up at night. You know, a lot of these are, psychological in nature. A lot of them are, you know, physiological in nature. And some of them are just things that bide your time, you know. So longer working hours is an example of that. Higher perceived workloads, that might be a psychological thing and a, just a time factor. So many different things that can contribute to sleep deprivation. Prevention techniques include anything that would contribute to more sleep, because that is the only cure to sleep deprivation. So this includes screen time reduction, shortened working hours if you can. You know, some people, they can control the hours they work. For those that can't, you know, that's not really an option. Stress reduction techniques. So a lot of people, like I said, you know, a lot of those are psychological in nature. So, you know, maybe they're just stressed about something. They're up thinking about it all night. They can't fall asleep because they can't stop thinking. You know, so maybe some stress reduction techniques might help them relax, that kind of thing. Exercise that can wear you out physically and kind of help reduce stress. That is a stress reduction technique. So, you know, that can help in multiple areas. Improve sleeping arrangement quality. Some people, they're just uncomfortable. They can't get comfortable, can't sleep. So that might help them get a little bit more. You know, if they're able to get more comfortable, they can, you know, fall asleep a little bit easier. And medication, you know, maybe like some NyQuil, that kind of thing, sleep medicine. Although this isn't really recommended as a long-term solution because they can have, you know, addictive and adverse side effects. So, you know, that might be a short-term solution, but it would be so much better to address, the root causes of sleep deprivation. Areas of health and wellness affected. Sorry about that. I think my dogs just kind of got at each other. I don't know if you could hear that. Specific components of health and wellness that are affected by sleep deprivation include negative physiological, neurological, psychological, psychosocial, and cognitive effects, as we kind of discussed just prior. Potential impact on the individual from sleep deprivation include deficiencies in reasoning, critical thinking, problem solving. All those things are, significantly reduced through when you're sleep deprived. Increases in risk taking, behavior quality decline in children, irritability, moodiness, low frustration tolerance, nervousness, depression, anxiety, increased feelings of stress, increases in pro-inflammatory biomarkers, prevalence of cardiovascular disease, decreases in leptin production, which is your, I can never say this word right, satiety, feelings of being full, the hormone that regulates that. I can never say that word. Increases in ghrelin production, which is like your hormone that tells you that you're hungry. Higher high density lipoprotein, cholesterol, and a weakened immune system. Additionally, they also produce noticeable and sometimes debilitating inhibitions to every aspect in the quality of life. Think about just how hard it is to do things whenever you're tired. I mean, you have a decrease in, I didn't mention this up in here, but you have a decrease in motivation. All you want to do is sleep. You don't want to do anything. And this is an extremely common side effect of, sleep deprivation. And they can also impact relationships, work quality, perceptions of personal health, interpersonal relationships, energy, focus, relaxation levels, and so much more. Whenever you're tired, you just don't feel like yourself. And a big part of the neurological, psychological, and psychosocial and cognitive effects are just you're feeling tired. Your brain doesn't work too well when you're tired. It desires sleep, so you need to fulfill that, and it kind of puts that fulfillment need above a lot of other things. Above your social needs, and above your cognitive needs, and above your psychological needs. So it can really be a hindrance to those kind of things. And public health risks are maybe not just as plentiful, but they're extremely severe too. As mentioned, sleep deprivation affects many cognitive and psychosocial functions. And this can include focus, work quality, decision making, energy levels. And so sleep deprivation can have extensive effects on the roads, in the workplace, and education, all things that require, those high levels of, cognitive function. And to kind of dive into this a little bit more specific, sleepy drivers who are operating motor vehicles are almost 3 times more likely to get into a car accident over their alert and awake and well-rested counterparts. Also, sleepy drivers are 5 times more likely to be severely injured in a car crash than their alert counterparts. While drunk driving and distracted driving do account for more crashes than sleepy driving, the likelihood of crashing while driving while driving tired are extremely significant. This is something that shouldn't be ignored. This is something that should be discussed, but it's not. Think about all the public service and announcements and commercials and those big signs that you see on the road, like all talking about like drinking and driving, or texting and driving, but not a single one, I've never seen a single one at least, talk about being well rested. Don't drive while you're tired, pull over, take a nap, that kind of thing. And granted, not everybody can afford that, that time commitment, but it's something that needs to be addressed at the very least. Similarly to driving, working while sleep deprived can have severe and even fatal consequences. Losing just 1 hour of sleep can significantly increase prevalence of workplace accidents and fatalities. Also, the quality of work performance decreases significantly among sleep-deprived individuals. Working accidents. Think about all the manual labor jobs that are out there, all the construction workers, all the heavy machinery operators, all the welders, all that kind of stuff, all those jobs that can be, all the manufacturers, all that kind of stuff. Those jobs can be extremely dangerous even when you're alert. So think about just how much more dangerous it can be, when you're tired and your brain isn't working at its full capacity. It can cause severe accidents. Additionally, this is especially concerning in medical settings, because nurses, doctors, and surgeons often have long shift rotations. They have those, I know a lot of nurses that are, they have the 72 hours on, 36 hours off, or whatever it is, that kind of long shift work. A lot of surgeons have that. They have to be on call. They have to be, they'll go in at 3 o'clock in the morning for emergency surgery sometimes. That can, and as we said earlier, that kind of shift work can significantly reduce sleep timing and quality. And in these professions where there's a lapse in focus or a single missed detail, that can literally mean life and death for a patient. So it's extremely important for the medical professional to be awake and alert. And also in a classroom setting, sleep quality and quantity is directly correlated with academic performance and learning capacity. So sleep loss is associated with a decrease in learning ability while sleep deprived, and can impact the overall education levels, resulting in a less educated population. So, going back to that 35% of the population sleep deprived, if that 35%, even so, I'm sure it's more. I know when I was, a high schooler, I was not sleeping as well as I should have. Definitely not sleeping as good as I do as an adult. But if that 35% still correlates, still carries over to you know uh, elementary school, middle school, high school, even college students, they're not going to get as well of an education because they're not going to be able to focus. They're not going to be able to critically think. They're not going to be able to learn as well as they would if they were awake and alert. Personally speaking, this is to put a little bit of condemnation on myself. Like I said, I didn't sleep as well as I should have during, my high school years, and I slept in class more than anybody I have ever met in my whole life. I slept in every single class, just about every single day. Because I was tired. I was staying up until 3, 4 in the morning, just doing whatever I wanted, playing on my phone or whatever. And, I was not learning. My learning was significantly impacted by this. And in all honesty, I don't know how I'm in college right now because my GPA in high school was like a 2.2. I barely graduated because of, the impact of my sleep deprivation. There are very few resources and strategies implemented in combating sleep deprivation. As mentioned before, there's so many healthcare professionals who neglect to even question patients on sleep habits and quality. And so because of that, they aren't really promoting solutions or strategies to resolve sleep deprivation. If you're going to a medical professional, they're probably not going to refer you to a sleep specialist, which, those do exist. Most people don't even know they exist. But there are some, resources out there. The American Academy of Sleep Medicine and other sleep advocacy groups like that provide a solid array of resources to inform individuals on sleep deprivation and, things they can do to combat it, things they can do to help. They provide resources that can link you to sleep studies. They hold seminars and all that kind of stuff on a pretty regular basis, regarding sleep health. So, and things you can do to improve your sleep health. Regarding work-related, recommendations for going forward, regarding work-related sleep deprivation, there's really not that much that can be done to combat associated risk factors, because many people are not able to simply quit working late shifts. I mean, nobody wants to work a late shift. That's not, nobody, whenever they're a kid, when you ask them what you want to do when you grow up, oh, I want to work night shifts. Nobody says that. Nobody wants to work night shifts. Most of the time it's, obligatory. You have to in your job, and you can't really give up your means for supporting yourself and your family. So, there's really not much you can do about that. Similarly, school-related sleep deprivation is also just as difficult to combat because, many individuals just simply get stuck staying up late in order to finish coursework. I know, myself personally speaking, I work full time and I'm also doing, school through CBU. And so, I don't get off until really late at night. I don't get home from work usually until about 9, 10 o'clock. And then I have to stay up throughout the week and, work on my schoolwork little by little, chisel it down. So sometimes I'll stay up at, until, 12, 1, 2 in the morning. And then I have to get right back up at 6:30 in order to make it to work on time. So, nobody really wants to do that, but it's a necessity. So it has to be done. In order to combat work-related sleep deprivation in these spheres, so in, coursework and in, work, a conscious effort must be made by business owners, teachers, and professors in order to reduce workload or working hours. There's not really much you can do on the student side of it or on the employee side of it. It really comes up to the employers and the, the school entity itself in order to reduce that, in order to be conscious of that. However, there are screen time related sleep deprivation can be reduced through the use of alarms, screen time limiting functions, which are present in almost every single modern cell phone model, and just behavioral changes, utilizing some self-control, saying like, okay, it's 10 o'clock, I need to get off my phone and go to bed, just that kind of behavior. Really is, a big thing to keep in mind in most people. Additionally, potential alternatives to combating sleep deprivation, I mean, like I said, they just really don't exist. The only cure for sleep deprivation is consistent and adequate sleep. However, there are many things that can be done to combat sleep deprivation, or at least bring more awareness to its effects. Like I mentioned earlier, an implementation of public health awareness campaign, on the effects of sleep deprivation. Like I said earlier, similar to tobacco or alcohol abuse, or using cell phones, or screen time, that kind of thing. It could bring the seriousness of sleep deprivation to light. Those things have been proven to work. Notable topics to include in a campaign like that would be the effects of sleep deprivation across all aspects of individual and public health, that we kind of mentioned earlier. Improving surveillance of sleeping habits. Improving surveillance of sleeping habits. That's hard to say. That kind of like self-control, setting those alarms, using that screen time limiters, that kind of thing. Delaying school start times. I didn't link a study to this, but I do know there are some out here. I didn't cite one, but there are some studies out there talking about delaying school starting times to maybe like 9 o'clock rather than 8 o'clock. Or I think there's some out there that have even gone as far as saying started at 10 o'clock. That kind of thing has significantly increased sleep prevalence in students. I know, anecdotally speaking, my cousins, they go to school in, they live in New Mexico, so they go to school out there. And their school, they do, they're still in high school. They're a little bit younger than I am. But their school, they start at 9 o'clock and they get out at, I believe it's 5 o'clock. Might be 4 o'clock. I can't exactly remember. But they're some of the most energetic and well-rested people I have ever met in my whole life. Also, on top of that, educating employers, universities, and schools about the effects of sleep deprivation. Like I said, like I mentioned in the slide prior, a lot of times, the employees and students, they can't really do much about their sleep deprivation. It's just they have an obligation that they need to meet, and they do so by sacrificing their sleep. And that kind of goes back to the workload that they're receiving. So, employers giving their employees, extended workloads, and things that require them to work well into the night. Universities and schools, giving them a lot of homework and giving them a lot of extracurricular reading and all that kind of stuff. It can really impact, educating them on it. It can really impact the amount of sleep that people are getting, through reduced workload. And also encouraging reducing late and long shift times. That can also, like I just said, going back to the employers, that kind of thing. So in conclusion, many individuals tend to think of sleep as a luxury, as something that is not inherently necessary, but the polar opposite is true. We are designed to sleep. Going even all the way back to Genesis, in the end, after God created all the work, he worked for that 6 days, and on the seventh day he rested. It's important to get our rest. We need our rest. We need our sleep. As such, it's a dire necessity for all individuals to function to their highest capacity in the public sector and to maintain individual health. It's important to be well rested. Also, missing out on sleep can cause or contribute to fatality, both through accidental death and through health-related conditions. It is so important to get sleep. I cannot stress that enough. And here's my references. I do have a lot of them, so I'll just kind of go through these a little bit. I'll pause on here for a second if you want to. And I would definitely recommend checking out a few of these studies, because they were actually really, really interesting. I really enjoyed doing this presentation, putting it all together, because being able to read these studies was actually extremely interesting. I enjoyed it a lot. But that's all I got for you, Dr. Stirs. I hope you have a wonderful rest of your day and rest of your year. And I am looking forward to hearing from you in the future. Bye-bye.